Hi everyone, Amber Canoy here for Everyday Kentucky, visiting Solutions Functional Medicine once again. And we are talking about GSM, Mandy. So what does that actually stand for?
So GSM stands for Genitourinary Syndrome of Menopause. This is a syndrome that is very personal. It is very disruptive to women near and in menopause. It's a result of decline in hormone saturation in the pelvic floor of a female.
So what does that look like?
So it has a long spectrum of symptoms, both urinary and vaginal. Most commonly associated with lack of estrogen is vaginal dryness, but also this can manifest as more than that. It can manifest as itching and dryness and irritation in the vaginal area and the entire perineum, as we call it. But this is also very important for urinary health. Women experience the urges to go to the bathroom when they realize they just simply went a few minutes ago. Urgency to go to the bathroom, bladder spasm, and eventually incontinence, and increased risk for urinary tract infections. That risk is because of lack of strength in the pelvic floor barrier that keeps germs outside of our body. When that barrier is compromised and the strength of those muscles are compromised, then germs that are normal on the outside of the body can go north into the bladder and colonize there and increase risk for urinary tract infections serially for women. This also leads to serial prescriptions for antibiotics, which can be disruptive to the gut health.
Which probably doesn't help a lot of other female health, because we know that lots of times when you're on a lot of antibiotics, you can get other infections.
That's exactly right, and it's very disruptive. This is a huge quality of life issue for women, and this disrupts relationships. Many women who are experiencing incontinence or lack of bladder control find that they simply can't leave home because of the humiliation of that. We want women to know that there are solutions to this, that there are things that can be done, and that there are upstream causes of that can be very, very, they can be easily managed.
Yeah, and you hear a lot of women, especially, I mean, I'm thinking about the women who I know who are anywhere in their 40s to like even 70s, that talk about the fact, oh, I've got another UTI, I've got another UTI. So they don't seem to have a problem telling their friends about that, but like what you're talking about, some of the other stuff, that might be the telltale sign that there's something else going on that they really need to seek help with.
That's exactly right. And preventative care is always better than managing disease. It's always better.
Yeah, because nobody wants to take repetitive rounds of antibiotics. Not good.
No, that's never a good idea.
All right, if they have questions for you, need a consult?
We would love for them to call us at Solutions and to have a conversation, and with any one of our hormone specialists here at Solutions, and find something personal for them that can help them with symptoms.
All right, give them a call.